remote villages of Burundi, access to healthcare is a luxury that only a few are fortunate enough to experience. Life here is a daily struggle against poverty, disease, and neglect. Yet, in the midst of these challenges, hope emerges in the form of compassionate care and healing hands. For 4 days, a dedicated team of doctors, nurses, pharmacists, and volunteers from IMIF Medical Outreach worked tirelessly to provide essential medical support to those in desperate need. Thanks to the heartfelt donations from generous supporters, IMIF were able to make a significant impact on the lives of many.
People in rural areas are poor. They suffer from diseases but stay home because they can't afford hospital treatment. We're grateful that these Samaritans came to help us. As you can see, people are starting to come for treatment. Some of them, including people I know, have been living with incurable illnesses for years.
Each day, hundreds of men, women, and children stood in line, with some traveling on foot for hours, up to 36 hours, to receive care. From minor ailments to serious infections, the team worked relentlessly to offer relief and comfort to those suffering.
I was sick with a wound on my leg. It swelled up and burst into large sores. I had been suffering from this wound for 6 months, but I never got any proper medication. I only used traditional remedies because I couldn't afford treatment. The place where I live is very remote, and most people have left. The medicine I used didn't help, which is why my condition got worse.
This outreach was more than just medical treatment. It was a beacon of hope for those in despair, a chance to live without pain, even if just for a moment.
May God bless you, honorable ones. May He bless you abundantly, and may you always remember us. I am very grateful. The doctor told me to take the medicine after eating, and I can see that I will finally have some relief.
The need is immense and the challenges are great. But with compassion, determination, and the continued support from our donors, IMIF Medical Outreach was able to treat 2,200 281 patients, changing lives one by one.
At IMIF, we conducted a medical outreach in Ngozi province. We carried out this initiative in Busiga commune, specifically in two hills, Rukeco and Cendajuru in Gahini. In Rukeco, we were able to treat 1,118 people, while in Gahini, we treated 1,163. bose hamwe babaye abantu 2,281. In total, we treated 2,281 people. However, we were not able to reach everyone, as we couldn't attend to them all. Many had gone a long time without access to medical care. The 2,281 people we treated were those we were able to reach.
But this outreach was more than just providing medical care. It was a moment of hope for the hopeless, a glimpse of God's love in action. It was a chance to live without pain, even if for just a while, as the hands of healing worked through the team.
Abantu bashoboye gufashwa bakakira Yesu nk'umwami n'umukiza. A
total of 77 people accepted Jesus as their Lord and Savior. But that's not all. Others received prayers and deliverance. Additionally, there were those facing social challenges, and we were able to talk with them and guide them on how to live a Christ-centered life.
Despite the dedicated efforts of the medical team, the supplies could not meet the overwhelming need. As the last doses of medicine were given out, some patients were left untreated, their hope fading into disappointment.
There was a problem with a shortage of medicine because there were so many people. It was shameful.
At
times, it was heartbreaking to see people who had walked for many hours to arrive here for treatment, only to leave without being treated.
They had come seeking relief, only to leave with heavy hearts, their pain unanswered. The sight of those who had to walk away, eyes filled with sorrow, was a painful reminder of how much more was needed.
The number of people was much higher than we had expected, and the essential medicines were quickly used up. Another challenge is that when night falls, the situation becomes difficult because there is no proper lighting. Sometimes we have to stop the activities, even though there are still many patients waiting.
During this medical outreach, IMIF expressed gratitude to the churches that provided space for treatment installations. As a token of appreciation, IMIF also gifted them Bibles. But healing does not stop here. The journey continues. With more support, more resources, and more hearts willing to serve, we can bring lasting change. because health is not a privilege, it is a right granted by God.